Hi, I'm Dr. Manny. Today I want to talk about pancreatitis and the case of Patrick Swayze. Very unfortunate and very sad case, and we wish him all the best. But let's talk about pancreatic cancer because there's a lot of questions about it. Pancreatic cancer is a very malignant tumor of the pancreas. It happens in people between the ages of 50, 60, 70s, and is usually found in the older population. The problem with pancreatic cancer is that it is a silent killer from at the very beginning. You rarely have any symptoms, although when it gets advanced, the typical symptoms are, weakness, tiredness, fatigue, weight loss. Some people have jaundice, in other words, yellowing of the skin. The diagnosis is basically made by getting some sort of X-ray, either a CAT scan or an MRI, where you see this tumor inside the abdomen. Typically, though, when you have symptoms, this is an advanced cancer which has very poor prognosis because, the earlier you catch any cancer, in particularly pancreatic cancer, the best likelihood you have of surviving. So if you have advanced pancreatic cancer, you're talking about survival rates of maybe 5%. The typical treatment, of course, is surgery and then followed by chemotherapy. There's no screening test for it, but there are risk factors, and this is the important part of this message. There are risk factors associated in developing pancreatic cancer. Number one is excessive alcohol abuse for a long period of time has been strongly associated with pancreatic cancer. The second thing is smoking, another risk factor. The third thing is there are some genetic predispositions. In other words, there's familial types of cancers that have been associated with pancreatic cancer. And of course, if you have metabolic diseases that you end up with inflammation or chronic infections of your pancreas, this could ultimately lead to pancreatic cancer. So the message is monitor the risk factors because right now we do not have the tools of making early diagnosis. Again, we wish Patrick Swayze the best of luck. And remember, send me your comments here at AskDrManny.com.